Welcome to Doctor's House Call. This is your chance to get in gear with Dr. Gear, a duly trained naturopathic medicine doctor and doctor of chiropractic, board certified in family medicine and minor surgery. Brought to you by Payson Health and Wellness Center at 801 East Highway 260 every Tuesday afternoon from 5 to 6, live on KMOG. You can call in now and speak to the doctor at 474-2427 with any questions, or after the show, call Dr. Gear during regular office hours, 474-7409.
This is Dr. Orville Weyrich on this edition of Doctor's House Call, which was aired live on KMOG on December 14th, 2021. We will be talking about what is truth. And on that topic, we will consider the number needed to treat, or NNT, for neuropathic pain. We'll follow that segment with what's new in medicine, a new Alzheimer's drug controversy. As part of our discussion of Alzheimer's disease tonight, we'll have segments where we discuss the idea that Alzheimer's disease is really type 3 diabetes of the brain. We'll talk about Alzheimer's and hyperbaric oxygen therapy, Alzheimer's and stem cell therapy, Alzheimer's and the French paradox, and Alzheimer's and the Primal diet. And then we'll have naturopathic pearls. And we'll look at naturopathic treatments of traumatic brain injury. So please stay tuned as we get started. Next topic will be pharmacological treatment of neuropathic pain. What is truth? What is the number needed to treat? So I wanted to talk about a paper that was published. It's been around a while now. It was published in 2010, but it is still very current. And what they did, this is what's called a meta-analysis. We talked about this before, where they go into the peer-reviewed literature. That is the scientist-to-scientist type of research article, not the ones that are in the New York Times that are written for 8th grade education. Mm-hmm. But this is doctor-to-doctor kind of talk. And we've talked about the concept of number needed to treat in the past. And this is a number that the drug companies usually don't tell you. But it's no surprise to especially pain patients that a lot of times the pills don't work. And so we can apply it to vaccines. We can apply it to any medical treatment. Mm-hmm. And the bottom line is, if you take a group of people, how many people do you have to treat in order to get one patient that says, that was a good treatment? It really helped me. And for the medications that we're talking about here, it's on the order of about 6 patients have to be treated in order to get one patient that says, that helped me. Mm-hmm. And so drug companies don't usually publish this number. And I talked previously on the show about the flu vaccine. There was a CDC program that I attended a number of years back where they were talking about the effectiveness of the flu vaccine for a particular year. And they said that for people in my age group, that's over 65, for people in my age group at that time, the number needed to treat was 40. That means 40 people had to get the flu vaccine in order to prevent one case of the flu. So, again, they don't like to talk about those numbers. But it's really the best way for the consumer to analyze whether a particular treatment is likely to benefit them. Mm-hmm. And there's another related concept, number needed to harm. How many people have to get the treatment before somebody is harmed, has a serious reaction to the treatment? Mm-hmm. And for a great drug, it would be thousands that you need to treat before anyone gets harmed. For a not-so-great drug, it might be as low as 6 or 10. And so you want a small number needed to treat and a very big number needed to harm. Right. And it's easy for the statisticians to produce these numbers. What we need to do is have more patients actually asking their doctors, what is the number needed to treat for this, whatever you are recommending for me? Mm-hmm. And what is the number needed to harm? Make an informed decision based on that information.
Huh. That's interesting. I've never even thought about it, never brought it up. I mean, how would most doctors react to that? Would they have the information?
Probably not, unfortunately.
Yeah.
Because where do the doctors get their information? They're largely trained by the drug companies to how to prescribe the drugs.
Right.
And so I hope I haven't made any enemies here in Payson among the other medical practitioners asking hard questions, telling their patients to ask the hard questions.
Yeah. Well, it is what it is.
So the bottom line is they looked at a number of different placebo-controlled, double-blind, randomized trials, and they looked at different causes of neuropathic pain. Diabetic neuropathy is one of the most common forms of neuropathic pain. Bad news is about 6 treatments are necessary for one patient to benefit significantly. So the best plan is, number 1, don't get diabetes.
Right.
And number 2, if you have diabetes, try to get it reversed or controlled. And consider some of our alternative treatments that improve blood flow. Because diabetic neuropathy, the small blood vessels are attacked. And so things that can improve the blood flow can improve the neuropathy.
And it goes right back to probably diet and exercise.
Diet, exercise, there are medications, there's pharmaceuticals, there are herbs that are of benefit. And I'll talk about some other things that might benefit as well in a little bit. So that's our second topic for the evening, which leads us into what's new in medicine. New Alzheimer drug controversy. So there is a new drug that was recently approved by the FDA called Aduhelm. I don't know where they come up with these names.
I've often wondered that.
But this is controversial because there were 2 large research studies that were done to determine the effectiveness of the drug. One of the 2 studies found that the drug was able to, quote, delay the loss of memory and thinking. Didn't say it was a cure, it would slow things down. The other study found no clear benefit.
Interesting.
Okay, but it gets more interesting. So the advisors to the FDA said, we don't think that you should approve this drug, but the FDA approved it anyway. And why would they approve it anyway? Well, my personal theory is there is no effective drug to treat Alzheimer's. And we have a growing patient population of people with Alzheimer's. And so there's a lot of pressure on the pharmaceutical companies and the FDA to come up with an effective treatment.
Oh, yeah. You hear it a lot in the news. That's, that's a big, Alzheimer's is a big, big subject.
And I have some good news on that topic. Good news for patients, not so much for the pharmaceutical companies, but I do have some ideas that seem to work. But let's talk about this drug a little bit more. It is the first drug that reduces what is called amyloid plaque, which is basically gunk that is messing with the brain function. So drug companies have been working for a long time trying to come up with a drug that would remove amyloid plaque because we notice that often people with Alzheimer's have amyloid plaque. And the drug companies assume that the plaque is causing the Alzheimer's. There's other researchers that say no, it's not the cause of Alzheimer's. It is appearing for the same reason that Alzheimer's is appearing. There's something else going on that is causing both the Alzheimer's and the plaque. And so this is a case where we fall back on my favorite saying that association does not prove causation. Mm-hmm. Just because two things happen at the same time doesn't mean that one thing caused the other. And if you don't have a good diagnosis of what is causing things, just because you clear the plaque out doesn't necessarily mean that you're going to have much of an impact on the patient. If the plaque is just an, oh, by the way, it happens at the same time that the brain is being damaged by something else. Mm-hmm. I haven't told you everything about it yet. It costs right now a year $56,000 per patient. So insurance companies haven't picked up on this drug. It's very, very expensive, and all the evidence is that it has a modest benefit. So that's a lot of money to spend on something that isn't going to work very well.
Right.
So I wonder what the number needed to treat is on this.
$56,000 annually.
Yes. Monthly treatments, which is an infusion. I'm not sure exactly how they're injecting this into the body, but it's not a pill. You have to go in and have the material infused into your system. And, oh, by the way, it has some side effects as well. So,
I mean, just purely based on the cost of that medication, why are they even wasting their time with it? I can't even think of a common person that could even come close to affording that, you know? And,
yeah.
And I would imagine the insurance companies won't touch it with a 10-foot pole.
Well, if it cured Alzheimer's, it would be worth it.
Sure.
I mean, I don't know what back surgery costs these days, but it's in the tens of thousands of dollars.
Yeah, that's true.
But you expect some real benefit there.
Right. And in most cases, you've got insurance to cover it.
Yeah.
You know?
Well, the insurance won't cover something that they don't think is going to be cost effective.
Right. Makes sense. I mean, you know, they don't have money to throw around, although I've got a whole opinion on that. But
well, the insurance companies, yes, they're there to make money, but
right.
They make their money by providing the most affordable care that people can find.
Right.
They get a service fee out of it. If they want to provide a particular benefit, particular treatment, somebody's got to pay for it.
True.
And ultimately, it's either the taxpayers or it's the patients. Mm-hmm. Either way, that's you and me.
Right. Yeah, that's the bottom line, really.
Sometimes Alzheimer's disease has been called type 3 diabetes or diabetes of the brain because there appears to be imbalances in sugar processing in the brain, which leads to some interesting naturopathic treatments that I'll talk about a little bit. It turns out that if you put a patient on a Atkins type diet, their brain works better. And because the brain can burn sugar or it can burn what are called ketone bodies. Atkins diet generates ketone bodies and reduces the amount of sugar. So if the brain has type 3 diabetes and can't process the sugar properly, fine. Get rid of the sugar and boost the ketone bodies. So that's just one natural treatment, and there's actually a medicinal food that was approved by the FDA that simulates this same process. And it's available. It has some benefit. Talk a little bit more about Alzheimer's and what does work. There is current talk about hyperbaric oxygen treatments that stimulate blood flow and stimulate the natural generation of stem cells. So what is hyperbaric oxygen? It was originally invented to treat divers that had the bends. Mm-hmm. So it's just a pressure chamber that they fill up with oxygen, and much higher oxygen concentration than what you have in room air.
Right.
Room air is, round numbers, about 20% oxygen, and most of the rest is nitrogen. Higher pressures of oxygen stimulate blood flow and stimulate healing. Other benefits of hyperbaric oxygen are wound healing. It's the best treatment if you have a gangrene, for example, on your foot or something, which unfortunately a lot of diabetic patients wind up with.
Right.
So gangrene is caused by a Clostridium bacteria that doesn't like oxygen. And so if you put the patient in a high-pressure oxygen situation, it kills the Clostridium. And it's about the most effective way, because Clostridium is very difficult to treat with drugs. So that's why we have a lot of amputation, because you can't get rid of it. But hyperbaric oxygen is a treatment of choice for that problem. So we know that hyperbaric oxygen benefits the brain. There's a problem, though. I can't prescribe it for my patients, or at least I can't talk about it on the air and then prescribe it for my patients, because the approved uses for hyperbaric oxygen don't include Alzheimer's. So if you have a bed sore that won't heal and you have Alzheimer's, hot diggity, we can prescribe the hyperbaric oxygen for your bed sores, and you get a twofer.
Yeah, right. Little added bonus.
But just to say I've got Alzheimer's and I want hyperbaric oxygen, we're in a gray area.
Right.
And that's unfortunate, but that's really because the FDA, Food and Drug Administration, really thinks in terms of pharmaceuticals that can be patented. And you can't patent oxygen. It's been around longer than people have.
Yeah. Yeah, I looked the other day at the pharmacy and I couldn't find a bottle of it. So
yeah,
little pill container, pop one each day.
Yeah, they do sell oxygen water, but I think that's malarkey.
Yeah, it sounds like a gimmick to me.
Because as soon as you pop the lid off, oxygen is going to be going away the same way as the fizz does in a soda pop.
Yep.
But what we do know about Alzheimer's is it does respond to hyperbaric oxygen. It responds to things that stimulate stem cells. Now, stem cells themselves are controversial because there's two main sources of stem cells. The first source comes from little babies. That has ethical issues.
Right.
The other source of stem cells is you yourself. It is possible now to, for example, take out about as much fat as the size of a D-cell battery out of your abdomen, and most people have a spare tire. I certainly have enough fat that I could contribute several D-cell batteries of fat.
Yeah,
they process it and isolate your stem cells and inject them back into you.
Yeah, I could actually power a utility vehicle, SUV.
And the ironic thing is the big interest among the scientists was the embryonic stem cells, because if you perfect that technology, you have a patentable stem cell culture. That can be sold over and over again to many different people. You just grow it in a vat and sell it, and it's patentable. Whereas your own stem cells can't be patented. They're unique to you. We could patent the equipment used to harvest the stem cells, for example, but we can't patent the stem cells themselves. But your stem cells, my stem cells, are very, very much better than fetal stem cells or embryonic stem cells. The reason is you know that you have blood type. And if you get a blood transfusion, if you get the wrong kind of blood, it make you really sick. And you know that for organ transplants, it's very difficult to find a match for a heart or a kidney or whatever, because everybody has different genes. And our immune system recognizes foreign tissues.
Right.
So we have to find somebody that's almost the same as we are. And even then, if we had an organ transplant, we would be on anti-rejection drugs for the rest of our lives, which reduces the efficiency of our immune system.
Right.
Sets us up for horrendous cases of COVID and everything else that's going around. But that's because the DNA is different from our DNA. My DNA, your DNA. And the chances of a fetus having your DNA or a close match to your DNA are almost nothing. And so the idea of taking fetal cells and injecting them into another person, generally speaking, it doesn't work very well because your body's going to attack those stem cells.
Right.
Because they don't belong there. So these are things that I've been talking about that are promising for treating Alzheimer's and other issues as well, but they're still not mainstream.
A lot of work to be done.
A lot of work to be done, and I've been dreaming of getting a hyperbaric oxygen chamber, but I don't think that's in my future, simply because they're very expensive.
Yeah, I would imagine. They're quite expensive.
But there's other things as well that treat Alzheimer's. There are various herbs that help stimulate formation of stem cells, activate the stem cells that you already have. Like I said, you've got stem cells in your abdominal fat that are just sleeping, basically, and there are herbs that can wake them up. And then they get busy and they look around for inflammation in the body, and wherever your body needs to grow new tissue, they glom onto that location and they start helping to regrow the tissue. So
what are some of those herbs?
Well, one of them is resveratrol, which is a component of a number of different foods, but it's most notably in red wine. And it's widely thought to maybe be responsible for what's called the French paradox. Have you heard of the French paradox?
No, I haven't.
Okay, well, the French people like to smoke tobacco, and they drink a lot and eat a lot of buttery foods. And according to U.S. doctors, they're doing everything wrong, and they should be train wrecks. But they have fewer heart attacks than Americans do.
Interesting.
So why is that? Maybe it's because butter is better for you than Crisco or margarine. That's a theory. Another theory is the resveratrol in the wine that they drink. It has a health benefit. So right now it's just called the French paradox because our doctors don't understand it.
They can't figure it out. Yeah, that is an interesting fact, because French food is incredibly rich, and of course, French are known for their wine and all of that, and but yet they actually have less heart attacks than Americans.
Yes.
Wow.
So we're either doing something wrong or they're doing something right.
Right.
And my theory is that animal fat is not bad for you. It's actually the high fructose corn syrup and things like that.
Right.
And my reasoning, and this is shared by many other doctors as well, but not all doctors, humanity has been on this planet for a long time. And most of our existence on this planet, we were hunter-gatherers. We weren't agricultural. So what does a hunter-gatherer eat? They're not eating bread. They're not eating white sugar. They're not eating high fructose corn syrup. They're eating animal meat. And Eskimos are an example of a group of people that still stick, at least in some places, stick to the old diet, which was very, very high in fishy fats.
Right.
Because there's not a whole lot that grows up in the frozen tundra, but very low rate of heart disease. And there's a number of doctors, anthropologists, and one dentist who made a study of many indigenous peoples throughout the world that were still living a hunter-gatherer type of lifestyle. And so the dentist, Weston went to all of these islands and so forth, found the old people practicing the old diets, and was amazed at how well formed their teeth were, for example, and overall health of them. And then he also found their genetic counterparts that had moved into the city and had adopted a more Western diet. And he documented that their teeth were not as healthy. And by that I mean, if you look at most or many Western people, they need an orthodontist. They need somebody to straighten their teeth. Whereas these natives that were on the original diet, they had beautiful teeth, all nicely lined up and not crowded. And so the thought is that there's something in their diet that benefits their bone structure that is not in our diet, or there's something in our diet that harms our bone structure. Right. So these are what are called cohort studies, and they're not the strongest scientific evidence, but they say something is going on here.
Yeah.
Doesn't prove what is going on, but we can have our theories. So the bottom line is humans have been eating meat for a lot longer than they've been eating bread, for example.
Correct.
And so
and Doritos.
Our genetics are adapted to eating meat and animal fat, not adapted to corn oil, for example, or high fructose corn syrup. And so garbage in, garbage out.
Right. That alone is a controversy, because, they'll tell you, no red meat and the big vegan thing and, all of that. And
Well, I have a couple observations on that. If you look at a cow or a horse, where are their eyes? They're on the sides so they can see what's going on around them, because they are prey. They're what the carnivore animals eat.
Right.
So they have to have eyes on the side of their head so that they are fully aware of their surroundings.
Correct.
Whereas if you look at humans or cats or dogs, where are their eyes? Right in front, so they can see what they're going to attack.
Right.
And look at the teeth. So human teeth are sort of unique in that we have both incisors for tearing, and we also have molars for grinding. So, but if you look at a cow's mouth or a horse's mouth, their teeth are more adapted for grinding, because they're eating things that need to be ground, not torn apart.
Right.
So humans are best viewed as omnivores. We were designed to eat both vegetables and meat and fish.
Yeah.
Some people, for various reasons, do need to have a special diet, which could be a vegan diet in some cases, but it's very rare that that's the healthiest diet for a human. And try convincing a cat that they really should be an herbivore. They're not going to listen to you.
Yeah. Well, try convincing a cat of anything.
Yeah.
Sorry, I'm not offending any cat lovers out there. Just saying.
Yeah, well, cats are smart, but they march to the beat of a different drummer.
Yes.
I've got a cat that figured out how to open my bedroom door by climbing up. And we have the lever type of door.
Right.
And just stands on his tippy toes and pulls the lever down and pushes the door open. And he figured out how to do it from the other side, too, by pulling the door after he pulls down. So then I stack boxes in front of the doorknob so that he can't stand there. And he's figured out how to climb on top of the boxes and push down. So, needless to say, I have bought a round doorknob that I will be installing shortly.
Next thing you know, he'll develop opposable thumbs. Then you're in trouble.
Yeah. Well, he might be able to use two paws if he could get enough traction.
Right. Well, you know what they say, the dogs, for instance, they'll say, gosh, this person feeds me and supplies all my needs and lets me out when I want to go outside and makes sure I have plenty of water and food and everything. gosh, that person must be a god to me, you know,
Yes,
and that's the way dogs look at us, you know.
And the other half of that is what a cat says.
The way the cat does thinks is, wow, this person feeds me, gives me water, takes care of me, waits on me. I must be a god.
Yes.
And that pretty much sums it up.
Yeah, and if you go on the internet, Google cat diary and dog diary. That's also some interesting reading. I will go on to our last topic of the evening, which is naturopathic treatments for traumatic brain injury. And I'm going to sound like a broken record. Hyperbaric oxygen, stem cells are good. Fish oil is very good for both Alzheimer's and TBI, people with concussions. And there was a study done a number of years ago on NFL players who, as you probably have heard, have a lot of problems with brain damage from the many, many concussions that they've gotten over the years. And I participated in a program. I have equipment that's called Neurofeedback equipment that stimulates the brain, and there have been studies that show benefit to traumatic brain injury patients. Not so much for Alzheimer's, at least it hasn't been shown, but for traumatic brain injury, this equipment has been demonstrated to be beneficial. It takes a while, takes a number of treatments, but it's another painless treatment. Just sit in the office with some electrodes glued to your head for a while, and very, very low power that you don't even feel, but it's stimulating the brain. And it's available at my office if anyone is interested. It's also useful for treating a number of other conditions like depression, anxiety, and autism.
Wow.
And it's very effective. And I'm board certified in neurofeedback as well as board certified in anti-aging medicine. So those are two of my internal medicine type specialties that we work with. And on my website, if you go to the area for Alzheimer's disease, and I'll put a link on my webpage, put a link on tonight's show's webpage, which if you go to drweyrich.com, at the top of the webpage, that's all you need, drweyrich.com. At the top, there will be a link to the multimedia archive. And at the top of that archive will be a link to tonight's show that has, right now, some supporting material, linked to some of these articles that I've talked about tonight, and to a couple of books that are relevant. But I will put up a link to my webpage that discusses treating Alzheimer's disease. And it turns out that there have been case studies, which are not double-blind, peer-reviewed, so it's lower quality evidence, but very convincing studies that shows that significant benefit can be had. Number needed to treat is close to 1. In other words, in this particular study, I believe 10 out of 11 patients had measurable benefit. They were, in many cases, unable to do their work, unable to balance checks, and after treatment, they were back at work.
Wow.
So that link to that paper is on my website in the Alzheimer's area. And what were we doing? Well, it wasn't me that did the study, but it's been published, peer-reviewed. And there's a long list of possible interventions, none of which by themselves help that much. But by carefully choosing 4 or 5 different interventions that appear to make the most sense for an individual patient, they were getting dramatic results.
Wow.
But that's not the way the Western medicine paradigm works. The paradigm that is used, best evidence, the placebo-controlled, double-blind study, randomized studies, they keep everything the same except for one thing. So they try one drug and see how well that works, comparing it to no drug. Mm-hmm. And they haven't found a drug yet that works very well at all. There's maybe 5, 6 drugs on the market now. None of them are particularly helpful, and including the one that we talked about tonight. But if you do a number of different things, like changing the diet, adding fish oil, addressing any nutritional deficiencies, doing hyperbaric oxygen, maybe that wasn't one of the ones that they used in the study, but it would be make a lot of sense to add that as one of the possible treatments. Mm-hmm. It is possible to customize a treatment plan that really does work.
Right.
But it is customized. It's not, here's the formula, go out and buy this and you'll be all set.
Right.
So the patients have to come to me or another doctors that provide similar treatment, and there are a number of them out there. Mm-hmm. Dr. Al Sears is a famous one down in Florida, has a institute that treats the Alzheimer's and traumatic brain injury and so forth. Very effective. And he does use hyperbaric oxygen. So they are out there. There's the authors of the papers that I'm referring to were in California. So, but it really makes a lot of sense to somebody trained as a naturopath who treats the whole body that these kinds of approaches could be very useful. So that's
a combination of many things that can work better than just one single.
Yes. So an analogy is go into the forest and gather up a bunch of twigs. Pick up any one of the twigs and you can snap it.
Right.
Take a bundle of twigs, try to snap that all at once, probably can't.
Yeah, exactly.
And so that's the same way with choosing a treatment regimen that involves a number of different approaches.
Makes sense. Absolutely makes sense. Well, we're about to run out of time here, so let's maybe looking for the word.
Okay,
summarize.
Let's wrap it up. Okay.
Summarize. Yeah.
Okay, so we do a lot at Pace and Health and Wellness. We don't just do spinal manipulation. I'm a naturopath. I'm not a chiropractor, but I'm trained the same way a chiropractor is trained, and I offer that service. Plus a lot of internal medicine. I'm board certified in both neurofeedback and in anti-aging medicine. We offer free 15-minute consults on any medical topic that you want to discuss with us. Call our office and make an appointment. During the wrap-up to the show tonight, our trailer, you'll hear our phone number that you can call during business hours. And go to my website, drweyrich.com, and there's a whole lot of information there. And it's still a work in progress because I'm still in practice, but I try to make it a little bit better every week. So let's roll the close.
All right. Well, thank you very much, Dr. Weyrich. It was good seeing you again, and thank you for listening. And that does it for this week's edition of Doctor's House Call.
You've been listening to Doctor's House Call, aired every Tuesday afternoon from 5 till 6 p.m. To call Dr. Gear after the show during his business hours at Payson Health and Wellness Center, 801 East Highway 260, call 474-7409 or go to his website, drbobgear.com. That number again, 474-7409.